Hello everyone. Greetings from Yenepoya Dental College. My name is Dr. Varsha Haridas Upadya and I am an associate professor from the Department of Oral and Maxillofacial Surgery. Today I will be talking to you about the process of tooth extraction, the instructions to be followed and the post-extraction care. Going to a dentist is every patient's worst nightmare. This often results in patients who postpone their appointments or don't go to the dentist at all. So what happens here is that a tooth which could have been saved in the initial stages ends up being extracted. So when would your dentist advise your tooth to be extracted? Please remember that extraction is the last resort of every dentist, and only when the tooth cannot be saved, you will be advised to undergo a tooth extraction. So these are some of the causes for which a tooth would have to be removed. The first and foremost, most common cause is dental caries. Now, dental caries is a condition where the tooth gets decayed starting from the crown and can progress up to the root. So if you see the picture on the top here, you can have caries which begins as a blackish discoloration of the tooth proceeding to dental caries, root caries and even periapical infections. So when a root canal treatment is no longer possible, your dentist may advise the tooth to be removed. Secondly, if you have not maintained your oral hygiene, you may end up in your gums getting inflamed and getting receded. What happens next is that the root of the tooth is completely exposed and the tooth starts becoming loose. So these mobile teeth which cannot be saved by periodontal surgery will end up getting extracted. In some children, the milk teeth do not fall off and the permanent teeth do not have space to erupt and may start getting erupted in an abnormal position, as you can see here in this picture. The permanent teeth are erupting on the lingual side, that is near the tongue surface, because the milk teeth have not fallen off. This can result in malalignment and you may have crooked teeth as you grow up. In such situations, your dentist will remove the milk teeth and make place for your permanent teeth. You may also have grown up with severe crowding, what we call, that is malaligned teeth, as you can see in this picture. So in order to create space in your dental arches, your orthodontist may advise certain teeth to be removed so that braces can be put and the teeth can be brought into alignment. Sometimes what happens is we have benign cysts and tumors which develop within the jawbone. If you have a tooth which is associated with tumors or cysts, as you can see here, when we remove the cyst or tumor, we may have to remove the tooth which is involved in the pathology. Sometimes you may bite on something very hard, or you may have had a fall, or you may have been in a fight. So what happens is that the tooth can fracture, as you can see here. The fracture may run from the crown of the tooth right till the root of the tooth. So in such situations, it becomes very difficult for your root canal specialist to save the tooth by doing any kind of endodontic treatment. So in cases of vertical fracture of the tooth and root, the tooth may have to be removed. Also, as different generations of mankind have been progressing, as the human evolution has been occurring, what happens is that the size of the lower jaw has been decreasing, because of which there is not enough room left for the eruption of your wisdom teeth, which we call as the third molars. Because the jaw is small but the number of teeth have remained the same, the third molar or the wisdom tooth is commonly impacted, that is, it does not completely erupt into the oral cavity and remains covered by some amount of bone and a skin flap. So over a period of time, what happens is that this skin flap may get completely traumatized. Every time you bite, it may get inflamed or it may undergo trauma, or there may be some amount of food lodgement happening below this piece or this flap of skin, resulting in infections. So in these situations, you will have to get your tooth removed. Now coming to the process of removal of the tooth. Now if you see here, this is an extraction socket. This is how a normal healthy extraction socket should look. So what happens is when you come to your dentist, you will be seated comfortably on the dental chair and your dentist is going to record a case history. So in the case history, along with your general details, the dentist is also going to pay a lot of focus and give a lot of importance to something called as your medical history. So he or she is going to ask you whether you have any systemic illnesses, diabetes, hypertension, any other endocrine disorders, any respiratory abnormalities, any history of hospitalization, whether you're taking any kind of medications which may alter the process of our procedure of extraction. Along with this, you will also be asked whether you have any dental history. That is this your first dental visit or have you undergone any dental procedures in the past? If yes, what was your or how was your experience? This will be followed by a general physical examination where your vital signs will be elicited and recorded, and also examination of the face followed by examination of the oral cavity will be carried out. So when your dentist is examining your mouth, he is also going to examine the tooth which he wants to extract and the surrounding soft tissues along with other parameters like the mouth opening. So once he or she has decided to extract your tooth, they are going to deposit a bit of local anesthesia near the tooth, as you can see here, to block the nerve which supplies that particular tooth. So once that area has become numb, your dentist is going to check for anesthesia, and then the first step is to loosen the gums which surround the tooth. So using special instruments called the periosteal elevators, the gums are gently freed away from the tooth. This is done so that when we apply our tooth extraction instruments called as extraction forceps, we do not damage your gums. Once the gums are reflected, the appropriate instrument for that tooth is selected and the extraction forceps is firmly applied to the tooth and the tooth is removed from the tooth socket as atraumatically as possible. Once the tooth is removed, there may be some amount of infection at the base of the root which will have to be cleared or debrided. So using curettage and curettes, which are the instruments used for curettage, the socket is debrided, and using antiseptic solutions it is thoroughly irrigated. If there are any prominent bony spicules, the bony filing will be done so that there are no pieces of bone which are jutting out. After this, your dentist may decide to place stitches, also called as sutures. This is to reapproximate the gums which we have loosened in the beginning. So this is how your stitches will look over the extraction socket. After this, again a gentle irrigation and a sterile cotton gauze will be placed at the site of extraction, and you will be instructed to bite on it firmly. So what are the instructions that you need to follow in the first 24 hours following a tooth extraction? The first and foremost instruction is the sterile gauze that has been placed over the extraction socket has to be firmly bit upon for a minimum of 20 to 30 minutes. This helps in arresting the bleeding and it also protects the socket for that duration of time. Kindly avoid talking a lot or trying to move the gauze or remove it during this phase. Before removing the cotton, please remember it has to be removed with clean hands so that you do not incorporate any kind of infection in the tooth socket. Also, do not spit out the cotton. Take all the medicines that have been advised by your doctor. It could be simple analgesics or painkillers or a combination of painkillers with antibiotics to prevent any kind of infection of the socket. Please remember not to spit for the first 24 hours and not to rinse your mouth for the first 24 hours because spitting and rinsing can tend to dislodge the blood clot that is forming in the extraction socket. This can in turn provoke bleeding. So fresh bleeding may start, or it may result in a painful condition called as dry socket, which I will be explaining to you next. Do not brush for 24 hours after the procedure. What happens when you brush is you tend to dislodge the blood clot, you tend to loosen the sutures or the stitches that have been placed, and you will even traumatize the gums in that area. So please do not brush over the site of extraction for the first 24 hours. Avoid consuming hot, hard or spicy food as these irritate the tooth socket and can delay the healing process. Try to consume foodstuffs or beverages which are at room temperature or preferably cold. So usually you may hear dentist recommending you to eat an ice cream after extraction. So why is this done is anything that is cold causes something called as vasoconstriction. So the blood vessels in that area, they constrict or they get narrower, because of which the bleeding to the site is reduced, as well as the chances of swelling are also reduced. Try to drink a glass of water after every meal, because you're not allowed to spit out or rinse your mouth for the first 24 hours. So it is very important to keep the oral cavity clean. So any food debris in that area, you can drink some water and wash it down, but please remember not to spit. Do not sleep on the side of the extraction, as you may traumatize the area and it can result in some amount of discomfort and swelling. You can apply ice on the site of the extraction, as this again, it causes vasoconstriction and decreases the bleeding. It also numbs the area and makes you feel more comfortable. Avoid any kind of aerated drinks or soda or alcohol, as they irritate the tissues in that area and can delay the healing. Do not drink anything using a straw. So if you want to drink a juice after extraction of your tooth, that is after half an hour, please remember to directly drink out of the glass and not sip through a straw. Because when we sip through a straw, we create a negative kind of suction which can dislodge the blood clot. So what are the instructions you follow for the next 24 hours? So these what we discussed are for the first 24 hours. After 24 hours, you need to follow another set of instructions. So you are allowed to brush your teeth. So you use a baby brush or a soft toothbrush, and you can brush the rest of your oral cavity gently. But at the site of extraction, please don't apply your brush over the extracted site and the suture area. You can start rinsing your mouth with lukewarm water, to which you add some rock salt. So nicely dissolve the salt in the lukewarm water, and you can rinse your mouth 4 to 5 times a day. So what salt does is it acts as a natural antiseptic and prevents infections in that area. We need to remember that the oral cavity is highly contaminated and our saliva contains millions of bacteria. So if especially you're prone to infections, such as if you are a diabetic patients, or if you are on any kind of immunosuppressant drugs or anything that lowers your immunity, you are more prone to infections. So rinsing with salt water is a natural antiseptic. If you see any frank bleeding from the site of the extraction, please inform your doctor immediately, because what happens is usually some amount of small ooze from the extracted site, a little bit of bleeding which may appear exaggerated when it is mixed with saliva, is completely normal. But if you have frank fresh bleeding which is filling your mouth with blood, please immediately contact your dentist, because they may have to look into the problem and resuture the area. Avoid smoking for at least 7 to 10 days after the extraction, because smoking the smoke of the cigarettes, it contains lot of chemicals which can hamper your healing, and also the heat which is generated during smoking can induce fresh bleeding at the site. Do not check the surgical site repeatedly. So usually what happens is once you undergo an extraction, you're so thrilled about it, you want to go and check in the mirror every 5 minutes, you want to go home and show it to everyone. So you end up repeatedly retracting or pulling at your cheeks and lip and showing the extraction site to everyone, trying to put your finger in that area or putting your tongue in that area to check whether the dentist, how the dentist has removed the tooth, have they removed it completely, and all those things. So kindly do not disturb the extraction site. It is in a process of healing. So by doing so, you are slowing down the healing process, and by sticking in a dirty finger, you may actually inoculate bacteria in that area and predispose yourself to developing a socket infection. If you feel that the stitches have opened up in the first 24 hours and you're experiencing bleeding from the site, please go back to your dentist, as they may have to resuture the area. Avoid strenuous exercises for the first few days. Try to take as much rest as possible, as exercises can increase the vascularity to the area and can promote further bleeding. Sometimes, as I told you, you have impacted teeth, that is wisdom teeth, which have not completely erupted into the oral cavity. They may be covered by a small amount of bone which has to be surgically removed using a dental drill. So in these surgical procedures, we create incisions or we make cuts in your gums, reflect a flap and expose the tooth which is covered by bone. The bone is removed using a dental drill and the tooth is sectioned or split and removed. In this process, you may experience more amount of inflammation or edema, that is swelling over the site, difficulty in mouth opening, etc. So along with following all the instructions that we previously described for a simple extraction, you may have to follow few extra steps if you have undergone a surgical extraction. So what are those extra steps? Application of ice packs on the external surface. So please take some ice in a packet or plastic cover and apply it on the external surface of your face. As we know, ice causes vasoconstriction, that is the narrowing down of the blood vessels, decreasing the amount of swelling as well as numbing that area and making you feel more comfortable. If you are experiencing difficulty in opening the mouth, there may be something called as trismus, that is the muscles in that area go into spasm, causing difficulty in you to open the mouth. So in such cases, you can apply hot moist towels so that the muscles in that area, due to the heat application, they get relaxed and you can stretch wider. Your dentist may also prescribe certain anti-inflammatory medications and muscle relaxants so that your mouth opening is easier. So what are the few complications that can occur after getting your tooth removed? So please remember that even though these complications are common, they are easily managed by your dentist and do not have any serious repercussions. So the most common is dry socket. So dry socket, as we earlier discussed, results due to loss of the blood clot from the socket. So why does the blood clot get dislodged? Is either you have not followed the instructions of the dentist, you have repeatedly rinsed your mouth, or you went on spitting, which has dislodged the blood clot, or you may be a smoker, you may be diabetic, or you may be a patient on oral contraceptive drugs. So these are the factors that predispose a patient to develop dry socket. Now dry socket, as you can see in this picture, your socket will look like this. Instead of having a blood clot, there is a grayish yellow slough that is present in the socket. Now since the blood clot is absent, the nerves which are present inside the bony walls of your extraction socket, they get exposed. So every time you speak, air enters your oral cavity, or every time you drink something or saliva just trickles down into the tooth socket, these nerves get stimulated and result in extreme pain. So your patient will come to you typically on the second and third day complaining of sleepless nights, severe pain in the extraction socket, and even a foul odor. So when you look into their oral cavity clinically, you will see a picture like this. This is called as a dry socket and can be easily managed by gentle irrigations by your dentist and yourself, and placement of certain intra-socket medicaments. So we have certain medicaments which we place directly into the tooth socket and leave it there, and that soothes the area and the healing process is going to continue. The next complication is something called as trismus. As I told you, in this picture the patient is unable to open the mouth adequately. So especially if you have undergone a surgical removal of a tooth, the muscles in that area may go into spasm. So when your muscles are spastic, your mouth cannot open adequately. So usually moist towels, muscle relaxants, physiotherapy exercises. So we tell our patients to practice opening their mouth, and we give certain appliances which help them to open the mouth. So this is called as trismus. Bleeding, this is one of the most common complications. Please make sure that when you visit your dentist, when they are recording your case history, make sure to tell your doctor everything if in case you have any issues of hypertension, that is your BP is high, or if you are on any medications which are antiplatelet. So they are also called as blood thinners. Antiplatelet medication, anticoagulant medication which may be prescribed by your cardiologist can increase your tendency of bleeding. So if you are on any of these medications, please inform your dentist prior to the extraction. Now suppose there is frank bleeding from the extracted site, please don't be alarmed. Try to keep some cotton which your dentist has given, bite on it and immediately go back to your dentist. They will check whether the bleeding is from the soft tissue or whether it is coming from the bone, and they will take the necessary precautions to stop the bleeding. You can also bleed into the soft tissues like this. So there may be bleeding into the tissues causing ecchymosis, it is also called as bruising, and it can be due to the same reason. So you have either a platelet disorder, or you have any bleeding coagulation disorder, or you're on certain medications which increase the bleeding, or you may be hypertensive. You can also develop something called as temporomandibular joint pain. This is usually seen in patients who have pre-existing pain of the temporomandibular joint. So the temporomandibular joint is a joint of the lower jaw which helps you in opening and closing your mouth. So what happens here is, if you have pre-existing temporomandibular joint pain and you have kept your mouth open for a long time during the extraction process, or if a lot of force has been exerted during the extraction, it can aggravate the TMJ pain, and this can be easily treated using muscle relaxants, giving rest to the joint, and also application of certain topical ointments. Coming to the next complication, which is also quite common, is infection of the tooth socket. You can see there is pus discharge happening here. Now, why does that occur is, one, you have not maintained your oral hygiene properly, you have not kept your mouth clean, or you have not taken the antibiotics prescribed by your dentist, or you have put a dirty finger and you have checked, or you have touched that area, and all these things can result in infection of that particular area. So please follow the instructions properly, take your antibiotics, and this condition can be resolved. If not, your dentist will debride that area and may have to resuture it and prescribe another course of antibiotics. So to summarize the post-extraction instructions, once you get your tooth removed, what are the do's and what are the don'ts? So if you see, all these pictures which are highlighted in green are the do's, what you should do after an extraction, and those which are in red are the don'ts. So these are the things you should avoid following an extraction. So first and foremost is, please tightly bite on the gauze pack which has been placed for a minimum of 20 to 30 minutes, which will help stop the bleeding. Take your medications as prescribed by your dentist without any fail. Do not miss any of the doses. Keep the area hydrated and moist. Try to eat something which is either at room temperature or something which is cold, like an ice cream. So this helps in numbing the area and stopping the bleeding. You can also rinse your mouth gently. This is after the first 24 hours, not before or not in the first 24 hours. So with some salt water, you can gently rinse the oral cavity. This can help prevent infections. Try to take as much rest as possible and do not do any strenuous physical activity. What are the don'ts you should not do? Do not drink anything using a straw, as the negative pressure can cause dislodgement of the blood clot and result in fresh bleeding or a dry socket. Do not consume hot beverages, as the bleeding may increase. Do not smoke, it interferes with the healing of the socket. Do not repeatedly spit the saliva or blood which is in your mouth, as this can again dislodge the blood clot, increase the bleeding, or may result in a dry socket. Do not poke the area with a dirty finger or with your tongue, or do not pull at your cheek and lips and repeatedly examine the site, as this can infect the socket and also delay the healing process. These are some of the printed instruction forms which will be given by your dentist following an extraction. So if you forget any of the instructions told by your dentist, all of these are available in a printed format which is handed out at the reception of every dentist clinic. So this contains all the instructions we discussed in the patient's regional language. So usually it will be written in at least 2 or 3 languages with pictures, so that you can easily understand and remember. So I hope you all remember these instructions the next time you go to your dentist for an extraction, and I hope you have no complications and a very comfortable extraction, post-extraction phase. Thank you for your patient listening.